Hello. Um, okay. Hello, everybody. A very good afternoon to everyone. Welcome everyone to MNCC Facebook Live and also Zoom talk show again. This week we are very delightful to have two very handsome and yet very knowledgeable doctors with us today. We are talking more about I have fatty liver and what does it mean and what should I do. So again, without further ado, let's move on to today's program. So I'll be your host today. My name is Andrew here. So we'll have 40 minutes talks by both of our speaker, Prof. Prof. Chan and also Dr. Chua. And also afterwards, we will proceed with a 20 minutes of Q&A session. So for a meeting orientation, during this meeting, please keep your microphone muted at all time. Hello. Okay, please keep your microphone muted at all time and keep your video and also camera off to ensure a more stable internet connection. And also for your information, these sessions will be recorded. Your participation in this meeting implies your consent for the recording. And by any chance, if you have any questions, do type it in the chat box on Zoom or also the comment section at Facebook Live, and we shall address your questions at the end of the session today. So before I proceed further, here's a small disclaimer here from MNCC. MNCC Health Talks, we aim to raise public awareness and promote healthy living. All the information provided today is not to replace a doctor's consultations. If you encounter any personal health problems, please do not disclose it here to protect your confidentiality, but consult your personal doctors. So let's move on to introduce our speakers today. We are so happy to have Prof. Chan Kheong here with us today. Dr. Chan is actually a professor of medicine in the University of Malaya and also a senior consultant in gastroenterology and hepatology with University of Malaya Medical Center and also University Malaya Specialist Center. At the same time, he is a member of the Academy of Medicine of Malaysia, the Malaysia Society of Gastroenterology and Hepatology, and the American Association for the Study of Liver Diseases. He was the scientific co-chair for the Asia Pacific Digestive Week 2021. At the same time, he's also a member of the Asia Pacific Working Party on Non-Alcoholic Fatty Liver Disease, the Gut and Obesity in Asia Work Group, the CAP Prognosis Study Group, and the Global NASH Council. So Prof. Chan is also the Associate Editor for Journal of Gastroenterology and Hepatology, a member of the editorial board for Council Clinical and Molecular Hepatology, and also a reviewer for several international journals. So Prof. Chan has published numerous full papers in peer-reviewed journals and presented both local and international conferences. His main interest is in the metabolic dysfunction associated with fatty liver disease. Today, we are so delightful to have Prof with us today, along with Dr. Chua, which is another handsome doctor with us. He's currently been appointed as a senior lecturer and also a consultant gastroenterologist and hepatologist with University Malaya Medical Center and also University Malaya Specialist Center. So Dr. Chua had also published numerous full papers in peer-reviewed journals and also presented both local and international conferences. So Dr. Chua also as a reviewer for Journal of Gastroenterology and Hepatology Open, PLOS 1, Journal of Gastroenterology and Hepatology, Neurogastroenterology and Motility, as well as BMC Gastroenterology Journal. He is very well trained with the general gastrointestinal endoscopy procedures and some of the advanced endoscopic procedures, including the endoscopic ultrasound and also endoscopic retrograde cholangiopancreatography. Today, we are so delightful to have two of the very leading person here in this field of gastroenterology that are going to talk to us more on fatty liver disease. So without further ado, let's welcome Prof Chan and also Dr. Chuah. So the floor is yours, Prof and Dr. Chuah.
Hello, thank you very much to Dr. Andrew for your very kind introduction. It's really a pleasure to be here today with my colleague, Dr. Chuah, to be talking to you about fatty liver. What does it mean and what should I do? But before I proceed, I would just like to express my thanks to Professor Loh Yi Chin, who actually invited myself and my colleague to share with you some of the important topics in gastroenterology and hepatology. So for today, we will be talking about fatty liver. The reason Dr. Chuah and I chose fatty liver was because fatty liver is a very common condition, but yet not many people know about it, or even if a person knows that he or she has fatty liver, he may not know that he can really do something to make a big difference to the outcome of the condition. So we hope that with this talk, we can really create the awareness so that people can actually do something to improve their health in terms of fatty liver. And before I start, Dr. Chuah, would you like to say a few words, as well as I think you have prepared a question for the participant as well.
Thank you, Prof. Chan, and thank you, the organizer, for having us here today to share with us these major problems that we are facing now for the community, as well as it's going to be getting more serious in future with the epidemic of obesity and metabolic syndrome. Okay, we are very happy to be here to share with you our knowledge, and hopefully by the end of the day, you all can gain something from it and improve your health, general health as a whole. Okay, before we begin, can we have the polling question? Okay, a very simple question to be interactive. Can I know whether do you have fatty liver? Is it yes, no, not sure, or don't know?
For those of you in Zoom, you can answer it directly on the poll, while for those that in the Facebook, you can type in the comment section. We will go through it as well.
Oh, very interesting answers. That's why it's important to have this talk.
Yes, indeed. So actually the result of this question is really consistent with how common the condition is in the general population. It has been estimated that approximately 20 to 30% of adults in Malaysia, as well as in the world, has this condition. Okay, so thank you very much for the question. I think we will get started, and you will notice that for this session, both Dr. Chuah and I will be on together, and we will discuss the slides that are presented, so that hopefully you know, you will be more interactive and you'll find it more interesting. So we'll just move on with the presentation now. So what is fatty liver? As its name implies, fatty liver is a condition where there's excess accumulation of fat in the liver. And as you can see on the left-hand side is actually a normal liver. If you were to take a small piece of the tissue and put it under the microscope, this is how it will look like. On the other hand, this is what fatty liver looks like, where more than 5% of the tissue actually consists of fat droplets. All those white color area that you see, circle white color area that you see are actually fat droplets. So as mentioned earlier, most patients with fatty liver are asymptomatic. Asymptomatic means they do not have any symptoms. So unless they actually go for a check, they probably will not know that they have fatty liver. Usually fatty liver is an incidental finding. For example, if a person go for a blood test, there's a test called liver function test. And if the liver function test is abnormal and further investigation is being carried out, the person may be diagnosed with fatty liver. The other common way fatty liver is diagnosed is through ultrasound examination. So a person may go for ultrasound examination for various reasons, at the same time incidentally found to have fatty liver. So it's very important here that fatty liver usually do not have symptoms. So unless you go for a check, either by a blood test or you go for an ultrasound, you may not know that you have fatty liver. But later in this talk, we'll share with you some of the common conditions that a person may have that will make us suspect that the person would also have fatty liver. And another very important point here is that because the disease has no symptoms, people would not know that they have it, and they cannot actually do something to prevent it from getting worse. And as the disease becomes worse and worse, when symptoms start to appear, it usually means the liver is starting to fail. And we call that decompensated cirrhosis. Some patients even present for the first time with liver cancer. So what are the causes of fatty liver? There are two main causes. First is alcohol, and another main cause is non-alcoholic fatty liver disease, or NAFLD. We will talk a bit more about these two most common causes of fatty liver today. So this is how the normal liver looks like at the top. And because of alcohol consumption, fat accumulates in the liver in a process called steatosis. Steatosis means fat accumulation. And as more and more fat accumulate, the patient will develop steatohepatitis. Steato means fat, hepatitis means inflammation. So steatohepatitis essentially means fat accumulation that results in inflammation. Take, for example, if you have a wound on your skin, it is red, swollen, and painful. That's inflammation. The same process happens in the liver, but the person may not feel it because the liver does not have a pain sensation. So unless the person go for a blood test whereby there are certain markers, we call it the ALT and AST. These are liver enzymes, and when there's hepatitis, when there's inflammation going on, these liver enzymes become elevated. And if nothing is being done, the inflammation will lead to scarring, just like scarring happening on our skin when there's a wound. After wound healing, scarring happens in the liver as well. But because the process does not really cause any symptom, it just go on, and after many, many years, more and more scar develop, leading to hardening of the liver, or what we call cirrhosis. And people with cirrhosis are at increased risk of developing liver cancer. And even up to the point where the person has cirrhosis and even early liver cancer, the person may not have any symptom at all. And like I mentioned earlier, once symptom develop, it usually means that it is end stage and very late. So for that, I will pass over to Dr. Chuah to talk to you about some of the symptoms that may occur when the liver starts to fail. Over to you, Dr. Chuah.
Thank you, Prof. Chan. As mentioned by Prof. Chan earlier, most of the patients are asymptomatic in the earlier stage. But as the disease progresses, when the liver fails, when the liver hardens and irreversible, they will develop cirrhosis. In situation of cirrhosis, where patient decompensate, then the symptoms may appear. And these are all probably very late stage of the disease already. Hopefully we can catch the patient before the late stage of disease. So in late stage of disease, in decompensated state, patient most common symptoms are jaundice. So in other words, jaundice is like a yellowish discoloration of the skin. Mainly, they will involve the whole body as well as the eyes. So why jaundice can occur is because bilirubin bile are produced and processed by the liver. When the liver hardens, when the liver fails, they cannot process and excrete and remove the bilirubin or bile from the body. Then the bilirubin accumulates and cause all this yellowish discoloration of the body. Then they will also develop generalized body swelling. Generalized body swelling can be due to multiple mechanisms in a situation of cirrhosis. One of it is because our liver produce protein. One of the main protein that will maintain the fluids in the blood circulation are albumin. So when liver fails, the albumin cannot be produced, and the fluids will, accumulate outside the blood circulation and in the eyes, in the body, and in the legs. Next, they can also develop coagulopathy. Coagulopathy, in other words, is like easy bruising or easy bleeding. They can present like easy bruising or easy bleeding because one of the liver main function is to produce the clotting factors of the body. As when the liver decompensate, they cannot produce enough clotting factors, and this will lead to all this coagulopathy, bleeding, bruising, etc. Then another very important problems that can occur is hepatic encephalopathy. Hepatic encephalopathy in layman term means that central nervous system disorder caused by the liver dysfunction. So what happens is our liver is the one that will process the toxin from our body. When the liver fails, the toxin cannot be removed from the body and accumulate in our body, and those toxins can cause confusion of a patient, and in serious case, patient can develop coma as well. Next, several other complications that can occur in decompensated cirrhosis. One of it is ascites. Ascites is what you can see in the earlier picture, where you can see a very distended abdomen, which is fluid accumulation in the abdomen. It's like similar to a pregnant lady, or sometimes even worse than that. You can see a very prominent distended abdomen. Patient can be very uncomfortable. Patient can have pain and difficulty in breathing because of the accumulation of the fluids, and sometimes even infection. Why it occurs is because our blood circulation mainly will pass through liver to process in a normal circumstances. In a hardened liver, our blood circulation cannot pass through the liver efficiently. So as a result, the pressure in the circulation of the liver builds up. When it builds up, the fluids cannot pass through normally, and the fluids will be pressure and push out from the blood circulation and accumulate all over the body, mainly in the abdominal space. That's ascites. Then another important problems that we frequently see in tertiary center or secondary center is patient presented with bleeding. They vomit out blood. They vomit out blackish material, or they pass out blackish material, or pass out fresh blood. So why it occurs in liver cirrhosis or liver hardening patient is because, as I mentioned earlier, the blood circulation, the pressure in the liver builds up. The blood cannot flow through the liver normally. Then they will bypass the liver and flow through the other parts of the body. One of the common parts is the esophagus, the vessels in the esophagus and the vessels in the stomachs. When the pressure, the circulation go through that pathway, then the vessel in the esophagus and the vessel in the stomach abnormally swollen. When it's swollen at certain extent and the severe extent, it may rupture and produce a massive bleeding. This can be very devastating for the patient sometimes. So when it presents to us, we will have to give medication. We have to do endoscopy and to stop the bleeding as well. Next will be hepatorenal syndrome. As you can see, hepatorenal syndrome is a condition where when the liver fails, the kidney fails together as well. So the kidney fails as a result of the multiple problematic mechanism of the cirrhosis and etc. Then another important thing also mentioned by Prof. Chan is hepatocellular carcinoma. So liver cancer can occur and more often occur in patients with cirrhosis or liver hardening or liver fibrosis or liver scarring. Okay, so these are the multiple presentation of patients that can occur when they are in the later or end stage of the liver disease.
Yeah, thank you very much, Dr. Chua. So I think the important point to really stress here is that chronic liver disease, for example, alcohol-related liver disease or even non-alcoholic fatty liver disease, patients generally don't have symptoms. They feel well, but by the time liver starts to fail and all these complication happens, it is really difficult for them to regain their health. So we hope that with this talk, there will be more awareness and people will look into this and to prevent them from developing the complication from a failing liver. In fact, in our hospital, we often see patients presenting for the very first time with fatty liver disease, but already have all these complications when they first present to us. So I would just like to talk a bit about how we can prevent alcohol-related liver disease. So as mentioned earlier, alcohol-related liver disease is one of the two most common causes of fatty liver disease. And to prevent it is really to stop drinking alcohol, or if not, at least stick to the recommended limits. So generally speaking, we should not drink more than 14 units a week, because drinking more than 14 units a week can cause, is enough to cause liver damage. So how much is 1 unit? Half a pint of beer, a glass of wine, or a shot whiskey is equivalent to 1 unit. So having more than 14 units a week is enough to cause liver damage. Another important thing is binge drinking. So having 5 units or more at one setting is also enough to cause liver damage. So in order to prevent alcohol-related liver disease, is really to stop drinking or to stick to the recommended limits. The good news is in patients with alcohol-related liver disease, even when there's a lot of fat, a lot of inflammation, and even when there's scarring, it can still improve if the person stop drinking. But of course, if the person has reached the very end stage of the liver disease, when the liver is failing with all the complications that you have heard earlier, stopping drinking at a time can help, but will not help as much as if the person does so when the disease is at its earlier stage. And in fact, a study has shown that there's no safe amount of alcohol that we can consume. Even a bit of alcohol increases a person's risk of mortality, especially a risk of cancer.
Prof, can we have a polling question? Actually, the question should be before the presentation of alcohol, but it's okay. Do you drink alcohol? If yes, how frequent? Yes, daily, almost daily. Yes, weekly. Yes, occasionally. No, I don't drink alcohol. I mean, this question is important. I mean, just to tell us that besides knowing, the Prof. Chan's presented the slides is important is because besides telling us that not only about the daily drinking or weekly drinking or occasional drinking, so we also need to gauge how much you drink a day. For example, not to go for binge drinking, not more than 5 in a setting, or if you really cannot stop drinking, you have to drink it in not beyond the limit as recommended.
Okay, thank you. I think most of our participants today do not drink alcohol or only drink alcohol occasionally. Let's move on. I think we are slightly behind time. I think next we'll talk about non-alcoholic fatty liver disease, which is really the most common cause of fatty liver disease nowadays. So it's a condition where there's accumulation of fat in the liver. And to diagnose this, we actually exclude alcohol intake, significant alcohol intake, as well as other causes of chronic liver disease. The reason this condition is called non-alcoholic fatty liver disease is because when it was discovered back in the early 1980s, a group of doctors actually described patients who have fatty liver disease that looks like alcohol-related liver disease, but the patients do not consume alcohol. In fact, they found that most of these patients are overweight or have metabolic conditions like diabetes mellitus. So nowadays, we know that most of these patients are overweight or obese, and the underlying cause is really because of overnutrition. In fact, currently there's an initiative around the world to try to change the name of this disease from non-alcoholic fatty liver disease to metabolic dysfunction associated fatty liver disease. We won't go into too much detail of that, but later on in this talk, Dr. Chuah will share with you what is meant by metabolic syndrome. So, and as mentioned earlier, non-alcoholic fatty liver disease is the most common cause of chronic liver disease. How common is it? So on the left-hand side is actually a study done in a group of people who went for medical health check. These are healthy people. It was found that 22% of these people had fatty liver disease. And when we look at patients with diabetes, 1 in 2 of patients with diabetes actually were found to have fatty liver disease. And in fact, when we did a study among our medical students who are young adults, we found that about 8% of them actually had fatty liver disease. So subsequently, after quite a number of years, we actually repeated a study using FibroScan. FibroScan actually is a device that allows us to measure fat and scarring in the liver. It's more sensitive to detect fat in the liver. And we found that 57% of health check individuals actually had fatty liver, and 17% actually had a lot of scarring in their liver. And among those patients with diabetes, 72% actually had fatty liver, and 21% actually had very severe scarring. So this shows us how common, this is really a very, very common condition among the general population. So perhaps Dr. Chuah can, enlighten us a bit how overweight and obesity and fatty liver develops.
Okay, in a normal circumstances, where our weight is maintained, it happens when we have when our energy intake is equals to our energy expenditure. In other words, our calorie intake is similar to our calorie, whereby our calories burn. Okay, in overweight situation, how did it develop? In simple layman term, it's when we have excessive energy intake, when we have excessive calorie intake, as you can see in this image, the lady is taking a high calorie diet, high calorie fast food. Then compared to, and at the same time, this obese gentleman is lying in sleeping in a sedentary lifestyle, whereby his energy expenditure is low. So when the energy intake is outweigh the energy expenditure, eventually the patient will gain weight. In situation where patient gain weight, a lot of time the fat will accumulate in the sense of accumulate in the subcutaneous tissue, the layer beneath our skin, and also inside our body, in our intra-abdominal, around our organ, where the accumulation happens around the organ. We call it as a visceral fat or visceral adiposity. When it accumulates in the liver, we call it as a fatty liver. If it's not related to alcohol, we term it as a non-alcoholic fatty liver disease.
So you, Dr. Chuah, for the clear explanation about how fatty liver develops due to overweight or obesity. So the spectrum of NAFLD, as you can see here, I have actually recycled the slide for alcohol-related liver disease. Essentially, it's the same process. There's fat accumulation, there's inflammation. But in non-alcoholic fatty liver disease, when there is fat and inflammation, we call it NASH, or non-alcoholic steatohepatitis. And this can also lead to fibrosis, cirrhosis, as well as liver cancer. Just so that you have a better idea of how the disease progresses over time, you can see on the left side is a normal liver. So NAFLD develop at a rate of about 3 to 4% per year. Okay, and out of those patients who have fat in the liver, 25% of them progress to get inflammation in the liver, as well as develop scarring or fibrosis on an average of 3 years. And those patients with NASH, they have fibrosis or scarring progression or scarring development at a much faster rate compared to those patients who only have fat without inflammation. So on average, a person develop increasing scarring at one stage over 7 years for those with inflammation. But for those with just fat without inflammation, the progression is one stage over 14 years. So that you have a clear idea, there are actually 5 stages of scarring in the liver. 0 means there's no scarring, 1 is mild scarring, 2 is moderate scarring, 3 is severe scarring, and 4 is hardening or cirrhosis. And once cirrhosis has developed, the risk of developing liver cancer is 1 to 4% per year. So as one of the important things that I would like to emphasize here is that the most important predictor of a bad outcome from fatty liver disease is the amount of scarring in the liver. Okay, we know that it's the inflammation that drives the progression of the scarring, that causes the scarring, but it's the amount of scarring that tells us, whether a person is likely to have a bad outcome or not. So as mentioned, there are 5 stages of scarring, and this slide actually shows us the risk of dying from liver disease. As you can see, the risk increases very much when the amount of scarring increases from stage 2 to stage 3 to stage 4, or when the liver is hardened. So as mentioned earlier, from the time that we heard about non-alcoholic fatty liver disease till today, it has been almost 2 decades. And we have a better understanding of the disease now, and we are trying to change the name of the disease to metabolic dysfunction associated fatty liver disease. In other words, we know non-alcoholic fatty liver disease is actually the liver manifestation of what we call the metabolic syndrome. And for you to understand what metabolic syndrome means, I will pass it to Dr. Chuah.
Right. Okay. So metabolic syndrome, there are multiple, several components in it. So one of it is central obesity. So central obesity defined as waist circumference 90 or more cm in men, or more than 80 cm in women. The second criteria is impaired fasting glucose or diabetes mellitus. So then other criteria were hypertension, if the blood pressure were 130 or diastolic of 130, or systolic of 130, or the diastolic of 85 or more. Then high triglyceride, one of the cholesterol component, serum triglyceride level of 1.7 millimole per liter or more, or low in HDL cholesterol. Low HDL cholesterol is the good cholesterol. If it's lower, means that patient has metabolic, possible have a metabolic syndrome. The serum HDL level of less than 1 in men, or less than 1.3 in women. So metabolic syndrome and also NAFLD or MAFLD, they are associated with high risk of cardiovascular disease. And in fact, cardiovascular disease is the leading cause of death in those patients. So therefore, it's important, number one, how do we screen for NAFLD patient, means fatty liver patient? we should screen it for those patients with obesity as well as overweight. Important to know that in Asia, the criteria for obesity and overweight is much lower than in the West. So we shall follow the Asian criteria, and in Malaysia as well. So the BMI of more than 23 is considered as overweight already. BMI of more than 25 is considered obesity. So we have to use the correct criteria, and we should screen all those patients that has high risk of fatty liver, overweight or obesity, diabetes patient, or fulfill any metabolic syndrome component. If they have all these criteria and they have fatty liver, we should also optimize the cardiovascular risk factor.
Thank you, Dr. Chuah. So I think I just want to add, Dr. Chuah mentioned about body mass index or BMI. So body mass index or BMI is just a reflection of whether a person is overweight or obese, and it can be easily calculated. You just need to take your body weight, divide by your height, your body weight in kilogram, divide by your height in meter, and divide by your height in meter again. So as mentioned by Dr. Chuah, if your BMI is more than 23, you are overweight. If it's more than 25, you are considered as obese. And if you're overweight or obese, you are at risk of metabolic syndrome. So in general, it's recommended that if you are more than 40 years old, you should go for annual health check. And this would include a simple blood test. And all these, fasting glucose, serum triglycerides, serum HDL cholesterol level can be found in the regular blood tests for medical check. And of course, the doctor can actually measure your blood pressure for you, and you can measure your own waist circumference. And if you have 3 out of these 5 criteria, then you have metabolic syndrome, and you really need to do something about it, both for the benefit of your liver as well as other organs in your body and for your general health. And perhaps Dr. Chuah wants to talk a bit about this slide about the likelihood of fatty liver according to the metabolic number of components of metabolic syndrome.
Okay, this study was conducted back in early 2010 and published in 2012. So this study showed that if you have more number of the metabolic syndrome criteria, you will have high likelihood of getting fatty liver. The more number of metabolic syndrome criteria you have, then higher chance of to have this fatty liver. As high as 80% if fulfill 5 metabolic syndrome criteria.
Thank you, Dr. Chuah. So maybe you can also share what we can do if we have fatty liver.
So therefore, it's so important for us to have this talk today. So to know that to screen for if this patient, if you have fatty liver and what we should do. So as mentioned earlier, is the energy expenditure and energy intake balance. So in order to have weight loss, in order to reduce our weight, we should increase our energy expenditure by going for more exercise, doing more healthy lifestyle, and at the same time reduce our calorie, reduce our energy intake. So in order to achieve weight reduction, that will be very beneficial in fatty liver, and that will reduce our visceral fat and reduce our steatosis in our liver and reduce the inflammation, and even can reverse the scarring sometimes. Okay, Prof. Chan, back to you.
Thank you. So I just share with you one of this study. It's actually done in nearly 300 patients who have a NASH. As you remember, NASH means there's fat, there's inflammation. And these patients were enrolled in a comprehensive lifestyle program for 1 year. So they eat healthily, they exercise, and they try to lose weight. And at the end of the study, they had a repeat liver biopsy to look at the severity of their disease. So golden color is actually those patients who managed to lose 10% of their body weight, more than 10% of their body weight. And blue color is those who lose less than 5%. Orange and gray is in between. And as you can see here, as the amount of body weight loss increases, more patients actually resolve the inflammation in the liver. As high as 90%, patients actually do not have inflammation anymore at the end of the study. And in fact, 45% of these patients had improvement in their scarring. So this is another study which included over 150 patients with fatty liver in a study which has two groups. One was a dietitian lifestyle program, and another group was usual care for a total of 1 year. And the outcome that the investigator looked at was the proportion of patients who actually resolve their fatty liver. That means the fatty liver disappears at the end of the study. And as you can see here, as the amount of weight loss increases, the proportion of patients who actually resolve the fatty liver increases. So much so that among those who actually lost more than 10% of their body weight, 97% of them had resolution of their fatty liver. The fatty liver disappears. And what I can say is that, this lifestyle change leading to weight loss not only helps the liver, but helps the person overall health and could reduce the risk of cardiovascular disease. In younger patients who have diabetes, diabetes can also be reversed. And in patients who do not have diabetes but have fatty liver, there are increased risk of getting diabetes. And by going through a lifestyle change, the person can actually delay or prevent development of diabetes. Cholesterol level can improve, triglyceride level can improve, blood pressure can improve as well. So I'll pass to Dr. Chuah to talk about how we can go on diet change and how we can do exercise in order to achieve weight loss, to improve fatty liver as well as our health. Over to you, Dr. Chuah.
Okay. Dietary intervention is a very important factors. So in terms of dietary intervention, calorie restriction is the most important factors in dietary intervention. So weight loss can result in significant reduction in liver fat and improvement in hepatic insulin resistance. In other words, help in the fatty liver in terms of steatosis, inflammation, and also scarring. So the APASL CPG, APASL is the Asia Pacific group, this clinical practice guideline for the diagnosis and management of this metabolic dysfunction, fatty liver disease in 2020. They recommend that gradual weight loss up to 1 kilo per week. And also they recommend that hypocaloric diet means that they have 500 to 1,000 kilocal deficit of kind of diet should be recommended to patients with fatty liver. In fact, to me, I would every time advise my patient to set a goal. We will always advise the patient to reduce 7 to 10% of the body weight. Then we will give them a number. Okay, 10% of body weight equals to maybe 10 kilo. And I will want them to reduce it like half a kilo to 1 kilo per week. You need to set a target for them, and they need to start to do it on the day itself, or make them, determined to start on which date. And by the end of 6 months or 3 months, when we see them back, we will want them to have that amount of weight reduction.
Yeah, so to add on to Dr. Chuah, I think some of the simple method to be able to try to lose weight, number one is to cut off sugary drink and sugary food. So a sugary drink and sugary food contains a lot of calorie, and a lot of time when we consume it, we don't realize that we actually have consumed a lot. So one way is to avoid sugary drinks such as teh tarik or your 3-in-1 coffee, or soft drinks, even juices. Juices has a lot of sugar in it. So one way is really to cut off sugary drinks and sugary food. And as you can see here, in order to lose weight, we need to cut off a certain amount of calorie. And what we could do is to actually reduce the amount. If we are eating at the amount that actually maintain our weight, in order for us to lose the weight, we need to reduce the amount by approximately 1/3. And of course, we should practice the healthy plate eating, whereby half of the plate would be vegetable and fruits, a quarter will be carbohydrate, and a quarter will be protein. And if you practice that, then in terms of diet, you are on the right track. And perhaps Dr. Chuah can mention a bit about exercise.
Okay. In fact, just to add on the diet per se, processed food as well as this fast food may not be healthy as well. It's not healthy as well, especially they have high content of saturated fat, which is not good for liver in terms of inflammation, accumulation of fat, and of course, in addition to what Prof. Chan has mentioned earlier. In terms of exercise, sedentary behavior is well known to be an independent risk factor for fatty liver. Also, again, the guideline has recommended at least 30 minutes per day of moderate intensity exercise for 5 days or more per week, or a total of 150 minutes per week. Or if they are doing the vigorous intensity exercise, 20 minutes per day on 3 days per week, or a total of 75 minutes per week. Sometimes some patient with fatty liver, with poor fitness, may have some osteoarthritis, pain here and there, may be difficult to do a moderate or other kind of exercise. They can do a resistant exercise, may be more feasible than the aerobic exercise. For example, cycling, that can be done as well for those patients.
So thank you, Dr. Chuah, to share. So moderate intensity exercise would include walking or brisk walking. So if a person has not been doing walking, just walk for even 10 minutes can be quite tiring. So always start slow and build it up. So perhaps at the beginning, just walk for 10 minutes first, after 2 to 3 weeks, and do it consistently. So consistency is more important than intensity. So as the person feels more fit, he can increase the duration to 20 minutes and eventually 30 minutes or even 40 minutes, and to try to do it consistently. So even walking is good enough. It's a moderate intensity activity, and try to target it 30 minutes a day eventually. So, and as mentioned by Dr. Chuah earlier, due to some reason, a person may find it difficult to do aerobic exercise. Resistant exercise will be just as good. So I think, we have talked about this in a person who has got obesity or overweight or the metabolic syndrome. It's really important for all the other metabolic risk factors to be controlled to reduce risk of cardiovascular disease. This would include treating the bad cholesterol to target, trying to aim blood pressure less than 130 to 80, as well as good sugar control with a HbA1c. HbA1c is a marker of how the sugar is in the body over a 3-month period. So it's optimal to have it below 6.5%. And smoking is a major risk factor for cardiovascular disease. Stopping smoking can really improve a person's health and reduce the risk of cardiovascular disease. I'll just go on to talk a bit about how do we know whether we have severe fatty liver disease. As you heard in the earlier slide, patients with diabetes, a high proportion of patients, 72% actually has fatty liver disease, and 21% actually has severe scarring in the liver. That's why a patient with diabetes, they are more likely to have severe fatty liver disease. And because of that, in the latest guideline on management of diabetes in Malaysia, there's a section on fatty liver, how we assess fatty liver in patients with diabetes. I'll pass that to Dr. Chuah to go through with you.
Right, okay. I can see in a questionnaire also some person has asked that for blood tests, if you also include liver function, can we tell that if the liver function is functioning well? So I'll be talking about this anyway. Okay, So how do I know if I have more severe fatty liver? So in terms of blood tests, for this is based on the CPG, our own Malaysian CPG of type 2 diabetes, which Prof. Chan is part of the panel as well. So in the guideline, it recommend that if to do a liver function at least annually for diabetic patient, and also general population, if after more than 40 years old, you should consider to do it annually. So if a person have normal ALT or AST, you can repeat it annually. If there's presence of elevation of ALT or AST, ALT or AST is a marker of the liver to suggest there's inflammation of the liver. It's part and parcel of the liver function test that we can do it in the hospital, in the community, or commercially. So if there's elevation of the blood test, usually we will recommend to do an ultrasound abdomen, at least to exclude a fatty liver, or to exclude if there's presence of focal liver lesion. In other words, maybe tumor, liver tumor, or other causes. Okay, if there's none, you may want, of course, at the same time, we will also want to look for other common causes. In this region, we would like to take the blood test for hepatitis B, hepatitis C as well. And of course, to evaluate if this patient is taking some new added medication, both over-the-counter supplements, or even prescribed by the doctors. So that could potentially cause the deranged or impaired liver function. If all the causes are excluded, we will advise to repeat the liver function after 3 to 6 months, especially after certain intervention, or even closer if the liver function is very impaired. And of course, to consider, refer to us as a gastroenterologist and hepatologist for further workup.
Yeah, so as mentioned by Dr. Chua, once we have ascertained that the cause of the elevation of the ALT and AST is due to fatty liver, then we would advise diet, exercise, and weight loss. And if the person can actually lose at least some weight, and possible 10% of their body weight, we can expect the enzymes to improve and even normalize. And as mentioned earlier, although inflammation is what drives scarring, scarring is really the most important predictor of whether a person will have bad outcome from the liver disease. And in the guideline, there's also a guide on how we can assess for liver scarring. Over to you, Dr. Chua.
Okay. So, besides knowing that this patient has inflammation, has this impaired liver function, another important is with this blood result, we can know that whether a person have a severe fatty liver or not. With the result of the liver function, AST, ALT level, and platelet, and the age, and come up and put up into a calculator, we can know whether we can gauge whether this patient has advanced fibrosis. Advanced fibrosis, it's a moderate to severe kind of scarring of the liver. If there's present, if the level based on this fibrosis 4 score, which you can easily assess this calculator online, and you put up the numbers using age, your AST level, platelet level, and also ALT level, then they'll come up with a number. If the number of less than 1.3, it's unlikely a person have advanced fibrosis. Then probably you can rest assured and repeat the blood test again in a year's time. Otherwise, in contrast, if you have a result of more than 1.3, potentially a person may have presence of advanced fibrosis. In this situation, usually should come over to see a gastroenterologist or hepatologist for further workup. I think Prof. Chan is going to explain to you what we can do potentially with that.
Yes, so just to add on, Dr. Chua, recently there have been more and more evidence that for those who are more than 65 years old, okay, for those who are more than 65 years old, because you see this fibrosis 4 score, it uses age as one of the parameter. So for those more than 65 years old, the 1.3 cutoff may be too sensitive. So patient tend to be picked up, to be suspected to have advanced a lot of scarring in the liver too easily with the 1.3 cutoff. So in those more than 65 years old, it has been suggested that we can use 2 as a cutoff so that it's not too sensitive. But this has not been incorporated in the guideline yet. But overall, more than 1.3, you can get evaluated further by this next test, which is called the liver stiffness measurement. It's much more accurate for assessment of scarring in the liver. But because the test is not widely available, that's why we have this risk stratification, whereby only those who have high fibrosis score suggesting of a lot of scarring in the liver should be referred for this test. So this test is a non-invasive test. It's painless and is easy to do, and it gives us immediate. The patient to be fasting for 2 to 3 hours prior to examination, and essentially the probe that you saw earlier generate a vibration that travels through the liver tissue, and it also has an ultrasound device that measures how fast the vibration travels through the liver. So if there's a lot of scarring in the liver will be very, very stiff. So the vibration will travel very quickly through the liver, and the computer will use that speed of the vibration and translate it to a stiffness measurement. So the more stiff the liver, the more scarring it is likely to have. Although, of course, there are some other reasons that cause the liver to be stiff, but usually it means that there's a lot of scarring in the liver. So in this particular patient, the reading is about 15. So what does 15 means? We'll just move on to the next slide. So this is in the guideline as well. If the reading is less than 10, it's unlikely that the person has severe scarring. So if a person has a reading of less than 10, there is actually 93% to 96% chance that the person do not have a lot of scarring in the liver. If it's between 10 to 15, the person may have a lot of scarring, and this require monitoring, and the person may be considered for referral to a gastroenterologist or hepatologist. And if the reading is more than 15, it's likely that the patient has a lot of scarring. And in fact, the predictive value, the likelihood of a person having hardening of the liver or cirrhosis is more than 86%. And this person should be considered for liver cancer surveillance. That means doing regular ultrasound to look for liver cancer just in case it develops, and should be considered for referral to gastroenterologist or hepatologist. And if the stiffness measurement is more than 20 to 25 kilopascal, it's likely that the person has swollen blood vessel as well. As mentioned by Dr. Chuah earlier, when the liver is hardened, the blood cannot flow through it very well. The blood vessel becomes engorged, and this may present as bleeding. So this patient should be considered for both liver cancer surveillance as well as for endoscopy to look for a swollen vessel, because swollen vessel has no symptoms until it bursts and bleed. So unless we do endoscopy to look for it, we may not detect it until bleeding happens. So those patients with liver stiffness measurement more than 20 to 25 kilopascal, they should be referred to a gastroenterologist or hepatologist. So I think we are almost at the end of our talk. And just to share with you, this is actually a very complete information for patient that was produced by a group of experts from Europe together with a patient group. So you can get information about fatty liver disease from this document, a lot of which we have covered in today's talk. And I think with that, ladies and gentlemen, Mr. Chairperson, Dr. Chua and I would like to conclude by saying that fatty liver is essentially excess accumulation of fat in the liver. And the most common causes are alcohol, as well as being overweight or obese. And more severe fatty liver can lead to hardening of the liver or cirrhosis, as well as its complications. And avoiding or limiting alcohol intake and maintaining or achieving a healthy or healthier body weight can prevent or reverse a more severe fatty liver and improve overall health. So if you think you have fatty liver, especially more severe fatty liver, please do consult with your doctor. I'll just stop sharing here, and both Dr. Choi and I will be happy to take any questions that you may have.
Thank you so much, Dr. Chua, and also Prof. Chan. It's really very informative session. So before we really move on to the Q&A, I have an interest to know, since we know that exercise is so important, 97% of, like, if you really weight loss with exercise and everything, you can revert this. How many of us actually exercising? I'm launching a poll now. Let's have a look among our participants. How many of you really exercise? Let's see how was it. Okay, quite interesting. We have a mixed kind of pictures with it. Yeah, Esther mentioned she did exercise. That's good, Esther. Okay, wow, quite.
Yeah, as you can see, not many, quite a mixed result. And
Yeah.
majority do not, many did not exercise, but many also, 35 up to 35% have exercised more than 150 minutes per week.
It's actually very good.
Yeah.
Yeah, I myself didn't exercise that much either. All right, so well, thank you for the great response. Okay, so now without further ado, let me share my screens and let us indulge with all the questions that the participants have with us. All right, let me have just a quick check. Everybody can see the screen I'm sharing. Oh, John mentioned he exercised 3 times a week. Oh, that's great. Victor exercised more than 115 minutes per week. Wow, that's cool. Wow, we really have a healthy crowd here. Okay, so again, I would like to emphasize here for everyone, if you have any questions, do type it in the chat box for all the audience in Zoom, and also for all the audience in Facebook, do type it in the comment section and we'll address it here. Okay, so Prof and Dr. Chua, are you ready?
Yes.
Yes.
All right, let's go. First question from participants, Redney 10 mentioned about how much wine can we drink per week to remain safe. I think just now we did touch a bit on it. And also the next question here, I think is quite rather interesting. By any chance, are wine and beer a safer option than whiskey in terms of developing fatty liver?
Maybe I can take that question, Dr. Chua.
Yeah.
And in fact, as mentioned earlier, there's actually no safe limit for alcohol consumption. But for the amount that would cause liver damage, generally is taken as more than 14 units. So if the alcohol consumption is less than that, then it's not likely to cause liver damage. So it doesn't matter whether it's wine or beer or whiskey. We actually look at the units of alcohol. And as mentioned earlier, half a pint of beer will be 1 unit, a glass of wine will be 1 unit, and a shot of whiskey will be 1 unit. I mean, it's important to have social life, to have a good time with friends and relatives, but to stick to the limit. Generally speaking, in one session, we should not consume 5 units or more of alcohol. That would be, for example, more than 3 pints of beer, or 5 glasses of wine or more, or a half a bottle of whiskey. So that will be more than the safe limits. And for patients who already have cirrhosis, that means already has a hardened liver, you really shouldn't be drinking, because even small amount can actually cause insult to the liver, and it also increases your risk of liver cancer.
I see. Thank you so much.
Yeah, I think in fact, those patients have any liver disease, for example, fatty liver disease with NASH, or even advanced fibrosis, or even hepatitis B or C, shouldn't be drinking alcohol. Because that will be add on to the insult of the ongoing inflammation.
That means it's any form of alcohol, right? Not even wine, not even like beer per se,
For
or
those
those.
with liver disease, especially, ideally should not.
Yeah, actually, it's interesting that there's idea that wine is actually safer compared to beer and whiskey, but in general, we believe that it's because people who drink wine, they have a lot of other factors that tend to be protective, maybe better socioeconomic status, better background, for them to seek healthcare and so on, so that those who tend to consume wine, we don't see as high complications from various health conditions compared to those who consume beer or hard liquor. Yeah.
Okay, interesting to know that. Thank you, Prof. Chan and also Dr. Chua. So move on. We have a question from Liu here. Is it beneficial and safe to consume liver supplements for a normal, healthy person? What say you, Dr. Chua?
Okay, I already expect this question will be asked in every talk, I guess. Okay, so at the moment, in various guidelines, major guidelines, both in Europe, America, and even Asia Pacific, they don't recommend liver supplement. But I suppose as long as those well-established liver supplements that do not cause any harm, may be harmless to take it. In fact, Prof. Chan has done a study on Legalon as well. It showed some amount of benefit in terms of improving liver scarring. Perhaps, Prof. Chan, you want to add on to your...
So I agree with what Dr. Chua has said. Generally speaking, the reason something is supplement is because the evidence is really not very strong, not strong enough for doctors to prescribe it to treat certain condition. That's why it's being sold as supplement. Most of these supplement like milk thistle, phospholipids, and so on, it can be taken. But the evidence is not very much. But generally, they should be harmless. But I also wouldn't recommend for patients to be taking a lot of supplements, because supplements still need your body liver and kidney function to process them. And having too much of supplement is also not good. So I would say that the evidence is not very strong, and you don't really need to purposely take it for fatty liver disease. Most important thing for fatty liver disease is diet, exercise, and maintain a healthy weight. But if you do want to take supplement, you can discuss with your doctor which supplement that would be recommended, because there's slight differences in the different supplements. Certainly, I wouldn't recommend you to take many types of supplement for fatty liver disease. Yeah, that will be my take for this question, Dr. Tan.
Okay, thank you so much, Prof. and also Dr. Chua. So I think the next question is, okay, now it's getting better. Okay, so I think we more or less touch on this follow-up question by Liu mentioned that what type of medication and supplement have impact on the liver. I think more or less we go through it, and I think Hong here have another concern with medication is that how do you gauge whether a psychiatric patient is exposed to drugs which may impact the liver, causing it to be fatty? Any thoughts, Prof. Chan?
Yeah. So I think in general, I'll just mention this generally. Medication, any medication can cause side effects. So when a doctor prescribes a medication, it really is based on the benefit of the medication, and that needs to be weighed against the risk. So various types of medication can also cause fatty liver, but if it's really needed to help control other condition that the patient has, then we have no choice. but to prescribe the medication. But often we try to maintain it as at the lowest possible dose to keep the patient's other condition under control. And of course, at the same time, the patient should also have a healthy diet, regular exercise, and that could reduce the risk of fatty liver from metabolic syndrome. And of course, try to limit alcohol intake because that can also contribute to liver damage.
I see. So the best it would still be for the person to try and talk to the doctors that prescribe you the medications, like go through the medications with them and then try and explore what the possible side effect that it brings through. And on the other hand, try and improve your lifestyle so that it's a bit healthier for your livers to reduce your liver burden, right, Prof?
Exactly.
Yeah, that's really good. And next we have a few questions related to some disease.
Dr. Tan, can I just add on?
Yes, please, Dr. Chuah.
Of course, the timeline is important now. When do the patient take the medication and how is it related to the impaired liver function? Perhaps there are a question on what types of medication have impact on liver, right? I mean, fatty liver. I mean, at the moment, of course, healthy lifestyle is the most important, as mentioned many times in this presentation. Diet as well as healthy, as well as exercise. But upcoming, they potentially may have more medication, but all of those are still in research. So consult your friendly doctors, friendly GPs, or your gastroenterologist and hepatologist if you have liver disease or severe liver disease. That's all. Next.
Yeah. All right. Thank you so much, Dr. Chua. So next we have a few questions regarding to some diseases. So this one from Ben Ong. People with gallbladder removed and angioplasty has higher possible of liver dysfunction. Is that the case, Prof?
Okay, so I will answer angioplasty first because I think that's quite clear cut. So if a person has to undergo angioplasty, that means the person has cardiovascular disease risk, in other words, metabolic syndrome, and the person usually tend to have a fatty liver disease and in fact a more severe fatty liver disease. And in terms of gallbladder, well, not directly, but we know that fatty liver gallbladder disease or gallstones, for example, tend to occur in overweight or obese person. So there's a link between having gallstones as well as fatty liver disease. But the gallstone itself would not directly impact on the fatty liver. Rather, in case the gallstones has migrated from the gallbladder into the bile duct and cause blockage, that can actually cause abnormal liver tests or so-called liver dysfunction. And that should be addressed. And it's a completely different matter altogether compared to fatty liver disease. Yeah. Maybe Dr. Chua wants to take the next question on liver rupture.
The liver ruptures. Liver ruptures can be reversed by regular exercise in the open with fresh air.
Can I clarify the question, or is it because liver cirrhosis or liver scarring or hardening? I suppose maybe typo, right? Maybe liver cirrhosis or liver hardening, right? So if it's a liver scarring, can be reversed up to 90%, up to 50% of circumstances if there's a weight reduction of 10% of the body weight. And in fact, up to 90% of reversal of steatosis means reversal of the fatty liver if there's presence of 10% of body weight loss. So whether it in the open fresh air or not, I don't think there's any study about it. But as long as any healthy exercise, I suppose they can help in fatty liver. They can help in scarring of the liver.
That means as long as you practice a healthy lifestyle, you practice your healthy diet, and also you try and achieve weight loss, it indirectly will help to improve all these conditions.
Yes, objectively, yes. And one more very important thing, sustainability. Based on the study that was shown by Prof. Chan, it only showed that actually up to 50% of the patient able to sustain the weight loss for 6 months or more. So important to tell ourselves that if we have achieved the weight loss, don't be too happy. We have to maintain it. We have to maintain healthy lifestyle for long-term benefit.
Yeah. It's better for your weight steadily comes down and then achieve a steady state instead of it going up and down, yo-yoing like that.
Yeah.
All right. So I think indirectly we kind of answered this question from Dato' I.R. Ang as well from our Facebook audience. Can fatty liver be reversed to become non-fatty liver? I think the answer is perfectly yes, because studies shown by Prof Chan just now also already proven that by improving weight reduction for more than 10%, the chances of you get the fatty liver resolving is also is quite significantly high.
It's more than 90%. Yeah, if a person can lose at least 10% of body weight, and the fatty liver will resolve in over 90% of the cases. And importantly, not only the liver will benefit, but the person overall health will benefit. The metabolic risk will also reduce, and the person's cardiovascular disease risk will also reduce. I think that's very important.
Yeah, I would say your diabetic is going to be better. Your hypertension control is your blood pressure control is definitely be more than excellent from before. And if your doctor assess you and if they think that there might be a chances that your medicine being cut down, right? Instead of like taking 3 or 4 type of antihypertensive or like 2 anti-diabetic medication, you maybe be cut down. But all of this, you really have to, number one, if you achieve a healthy lifestyle, you achieve your weight losses. And at the same time, we would really suggest you to sit down with your doctors that treating you, who treat all your hypertensions and everything. Discuss with them. Look, now I achieved this kind of weight. How's my blood sugar like? How's my blood pressure controlling? Like, do you think that there is a possibility that my medicine being cut off? All this, we really advise you to discuss with your doctors, and then from there, you'll see how you can move on now. But definitely healthy lifestyles and also weight reduction have a significant effect on all this. So next is liver cyst a cause of concern? Dr. Chuah, any view on this?
Okay, so liver cyst is a common thing that we may detect during the ultrasound. So liver cyst, generally, if it's a simple liver cyst, it's not a complex cyst, it's just pure or simple liver cyst, usually is not much of a concern. But having said that, some cysts may be very complex, some cysts may be very large and cause symptomatic, may be problematic. But generally speaking, a very simple liver cyst shouldn't be a major concern. I mean, to determine that, consult your doctor on that will be advisable.
Yep, and then if really in doubt, we would say that maybe just walk into a gastroenterologist or a hepatologist to discuss further, right?
Yes, in fact, even a hepatobiliary surgeon as well.
Yeah, talk to the expert if you really have some concern on your health. So next, let's move on. Okay, this one I found it quite interesting. Are there any evidence that fasting can reverse non-alcoholic fatty liver disease changes? Any idea on this, Prof Chan? Since fasting had been quite a hot topic now, in fact, people are talking about intermittent fasting, that is like you are like hourly 16 hours of fast and break fast at 8 hours. Some of them even go by days, like alternate day kind of fasting. Some of them even like fasted for, in a week, they fasted for like, let's say 3 days and then they resume their meal, all those things. Yeah. What's your thoughts on this, Prof?
I think the benefit is quite clear. Fasting actually forces our body to use fat as a fuel source, and that can burn off some fat. But of course, it should not be compensated by very large meal on breaking fast, because then, that would not result in calorie deficit. So as mentioned earlier, whatever way it is, as long as there's a reduction in the calorie intake and increase in physical activity, there should be weight loss. and that can help improve overall health. So I think one other thing, there's one question from the audience which I think is important, is the lower limit of body mass index as considered as healthy. So the lower limit is 18.5. If it's lower than that, it's considered underweight. It is not healthy to be underweight as well. And I think this is important because after today's session, I wouldn't want any of our participants to go on excessive weight loss so much so that they become underweight. So personally, I've seen patients who go on very low carbohydrate diet or fasting. They starve themselves so much so that they lose weight. So they will see improvement if they were overweight or obese to begin with. They will see improvement in their sugar, cholesterol, blood pressure, but if they continue to lose the weight and they become underweight, they will have other health problems. Yeah, not too much of weight loss. Yeah,
actually the question been brought up by Kee Huat and Nyok Lien, right? This one. Dr. Chuah, anything to add on?
In fact, Prof. Chan, you want to add on those patients with lean fatty liver?
Oh, yeah. So so-called lean fatty liver. So lean fatty liver is when the person's body mass index is normal, is less than 23, but yet has fatty liver, or non-obese fatty liver, whereby the BMI is less than 25, but the person has fatty liver. Usually, this can be two distinct group of patients. One is those who are young and they are just starting to accumulate fat in their tummy as well as in their liver. So they are just starting to accumulate fat, and if they don't take care, what happens is that more and more fat will accumulate, and they start to have some abnormalities in their blood tests, whereby the triglyceride levels start to come up, the HDL cholesterol start to come down, their fasting sugar is borderline, blood pressure a little bit, on the high side. If they don't do anything, they will continue to develop, high cholesterol, high triglyceride, high blood pressure, and even diabetes over time. So they still need to take care, healthy diet, exercise, lose a bit of weight, and the fatty liver can resolve, and they can actually reverse their abnormal cholesterol, improve their blood pressure as well as sugar by doing that. The other group would be older people who actually have a more severe fatty liver. Okay, and because the fatty liver is already at a very advanced stage, and they don't eat as much, they feel tired easily, they start to lose muscle mass. Okay, they still have a lot of fat in the tummy, but they lose muscle mass, and because of that, when they calculate their body mass index, it's actually not obese or is normal. So that's the other group, and this group, they may actually have a worse outcome. So there are two distinct groups.
I see. So in our next question from the participants actually have this concern that this lady, 21 years old, been told to have fatty liver, but she barely learned and taste alcohol, and she's a lean person, used to be active in high school and participate less in games since university. So really there are this group of people that can still develop this fatty liver disease without being obese or alcoholic.
Correct. In fact, it's very interesting. Yeah. Among people who are very active when they are in school, and they tend to eat quite a bit as well to sustain their energy use. And for example, once they further their study or they start working, they have less time for exercise, or maybe their exercise is not as intense as it used to be. But they still continue to eat a similar amount as they used to when they were younger. Because of work stress, people may actually have binge eating as well. They can still be within the normal BMI, but fat is starting to accumulate. So really is to try to reduce. As we age, the energy intake actually goes down. And as we become more sedentary, we are less active, we actually don't need as much energy as when we were younger. What do you think, Dr. Chuah?
In fact, this lady, a young lady with lean NAFLD, important. They, however, should go for healthy lifestyle as well. Perhaps she doesn't have to reach the level of 7 to 10% of a body weight reduction. In fact, any body weight reduction is helpful. And even some guidelines has recommend that for those lean NAFLD, recommend that reduction of body weight of 3 to 5% sometimes is sufficient to help them improve with all these overall inflammation, NAFLD, etc.
Yeah. So one thing I think important is that, although it's most probably because of the metabolic dysfunction associated fatty liver, but if a person is really lean and still has abnormal liver tests, we need to consider there are some other rarer causes of liver disease that can result in fatty liver. So, for example, autoimmune hepatitis, where the own body attacks the liver, a certain viral infection of the liver, like chronic hepatitis C infection, or even some inherited abnormalities of the liver, like Wilson's disease, can actually cause fatty liver. So if there's any doubt, especially, for example, if the person is very lean and blood test is all very good, cholesterol, sugar, blood pressure is all good, and we need to think, and liver test is very abnormal, we really need to think whether there are other less common causes of the fatty liver. So, and especially if the person has already gone on diet, exercise, and maybe losing a bit of weight and the liver test has not improved, we really need to consider other causes. And if there's any doubt, please consult a doctor or specialist in this area.
I see. So that is really interesting to know that. And the sidetrack on that is that women have higher chance of developing fatty liver. Is it a truth or is it a myth? Dr. Chuah, what's your take on this?
I think not very clear cut. I'm not very well aware of this. I don't think there's any clear cut evidence on this. Or Prof. Chan, do you have any other idea?
So in fact, at the same age, in the same age group, women are less likely to have fatty liver compared to men. So and actually, fatty liver increases as the age increases from young adulthood, from adolescent to young adulthood to older adult and elderly. The likelihood of fatty liver increases. For men. For women, it remains quite stable until menopause. So the female hormone actually protects against fatty liver as well as a metabolic syndrome. And if a woman is menstruating but has diabetes, high blood pressure, high cholesterol, or fatty liver, that means the metabolic syndrome is actually quite severe, because once a woman reaches menopause, if there's already a tendency to have metabolic syndrome that has been protected by the female hormone, after menopause, all these will start to manifest. And right after menopause, the likelihood of fatty liver catches up in women, so much so that it's same or even more than in men.
I see. So there is some truth in this statement in it, but then, we really need to see at different time stage, everything. But again, we will just advise people that having some healthy lifestyles with some exercise and take care of your diets, no matter you are man or woman, that is really helpful for your liver health. All right. So next, I think we have one since we discussed about what we call that non-obesity, or non-alcoholic fatty liver disease. So Bing would like to know that if for a person that is underweight and yet developing fatty liver, just now we talk about someone that, you may be lean and you might be exercising, and then but when you start slow down your energy expenditure, then your intake is still catching it up, so you will have that accumulation. So I think this one indirectly will also answer it already. And like Prof. Chan mentioned, that there might be some other more rare things to consider. And if really this is your concern billing, you really should walk into any hepatobiliary center or any gastroenterologist or hepatologist, talk to them and discuss further with them and see what are the options. Yeah, Billing mentioned it answered her questions. Thank you so much. All right, let's move on. Okay. Can a person not overweight have fatty liver? I think we touched this very nicely already. This person has a series of high GGT for more than a year and a cyst in the liver. I think for Kim, your answer are the same with the previous one. More or less, we discussed it quite extensively already. Just if you're really still concerned, walk into any of the gastroenterology or hepatology clinic and have a discussion with the specialist there. So Sufi would like to know that once diagnosed with fatty liver, how frequent should they check on the LFT and also the ultrasound? I think Dr. Chua did mention about this just now, right?
Right. So for this question, it's important to revise it again. So in patient diagnosed with fatty liver, it's important to check the liver function. If the liver function is completely normal, it's advisable to do a yearly to do a yearly liver function test. Okay, ultrasound may not be needed to repeat, but to repeat ultrasound every year, of course, to calculate as well the FIB-4, as I mentioned earlier, that you can find it online, the calculator, by putting the age liver function test as well as the platelet. If the liver function is deranged, or the FIB-4 criteria is raised, you should consult your doctor and even consider to consult the hepatologist. If FIB-4 criteria is high, then we will proceed to non-invasive criteria, the test like fibroscan, to look for liver stiffness measurement. If liver stiffness measurement shows that it's advanced fibrosis, that's a time where we need to do ultrasound HBS, the hepatobiliary system, to look for any potential early liver cancer or not. And you should do it every 6 months if there's presence of advanced fibrosis. Because with the advanced medical therapy nowadays, if we find out an early liver cancer, many therapies can be done, including including surgery, including local regional therapy by the intervention radiologist or oncologist. Many things that can be done and can potentially cure the patient from the liver cancer if we detect early. Okay. Of course, having said that, liver function, if there's a deranged liver function, we have to repeat more frequent. Otherwise, if normal, we probably can repeat every year.
I see. All right. Thank you so much, Dr. Chua, for the info. So let's move on. Hong here have questions on what is the benefit which one will derive from enhanced external counterpulsation ECCP treatment, especially to reduce the fat content in the liver. Any idea, Prof. Chan?
Actually, I don't know what this treatment is, and that's why I don't think I can comment on it.
All right. Okay, never mind. So unfortunately, Kheong, maybe you need to do some homework on this. We can't really give you the answer here. So we move on to the next one is Liu here again. I know of an 80+ man who drinks a small cup of Chinese wine every day to keep him healthy. He does not have any health issue. How is this so? Prof. Chan.
Okay, so actually a small cup is still within limits. And of course, the body ability to handle alcohol is very different from person to person. I mean, each of us is different in our own way. So I think, first of all, it's within limits. And secondly, I think he has got good genes.
Okay, So again, we'll just emphasize this again. If you would like to consume alcohol, do consume in moderation. Consider the limits that we mentioned earlier on per week, how much you should consume, and per session, not more than 5 units. That's how we should calculate it. No matter you are drinking wine, you are drinking beer, or you are drinking whiskeys or any other form of alcohol, that should be in your considerations, lah. So.
And don't drink and drive as well, I think, because yeah, that's very important. One of the cause of mortality, especially among younger people, is drink driving.
Yeah, thank you so much, Prof. Chan, for this reminder. Yeah, it's true. Don't drink and drive, and that is really dangerous. Okay, so Kee Huat here, he just now asked about the BMI thing. So he was like telling that his understanding the lower limit of BMI should be 18.5, and then can a person be healthy? Can one have a lower level than this and yet be healthy? I think this is a bit challenging. Like what Prof did mention earlier on, those underweight person do have their own concern, and we really don't want our audience after this, everyone go for intensive exercise rigorously and bring down your weight down even to underweight, because to be honest with you, and this group of underweight people have their other concern on their medical attention as well, right, Prof?
Yeah, exactly.
Okay. Oh, I think we have one last question from June here. For blood tests, we also include liver function. Can it tell if our liver is functioning well? I think more or less June would like to know that just by doing the liver function test, the AST, LT, all those things, is it good enough to tell that our liver is functioning well? Any idea, Dr. Chuah?
Okay, so liver function more or less can tell us in a certain extent. As you can see, more important is you could even calculate the FIT4 criteria to at least know that you're not in a severe state of fatty liver. But of course, there are other parameters that is important to look into it as well. The synthetic function of the liver. Yeah, I mean, if it's completely normal, not only the enzyme, the albumin is also normal, the bilirubin is also normal. Of course, the platelet level is normal, and you put it into a calculator of a FIT4. If it's also normal, generally less likelihood that the liver is not functioning well.
I see. Thank you so much, Dr. Chuah. I think with that last questions, we comes to the end of the session. Most of our participants are really quite happy with it. And thank you so much, everyone, for joining us today. And we are so happy that today, in fact, our Zoom reached the maximum capacity of 100 participants, and Facebook also maximum having 30 persons. So altogether 130 people staying with us. And in Zoom, we still have 78 staying with us. So before I end, I would like to launch one last final poll with everybody. Okay, let me just run this poll first. Okay, your feedback is really helpful for us. It's just a very brief 3 questions here. We would really like to know how you think these sessions today and for the future talk, because the pandemic is towards the transition time to being endemic. So there are chances for physicals and also more activity. So we would like to know your thoughts. What would you prefer? And also, would you think that today's talk is a bit difficult for you to understand, or you think this is just nice? So this is really, really helpful for us to gauge our sessions later on. Again, we would really, really like to thank Prof. Chan and also Dr. Chuah for spending a wonderful Saturday afternoon with us today and share with us so many insights, so many knowledge on non-alcoholic fatty liver, alcoholic fatty liver, or anything under the sun regarding regarding fatty liver disease. And really, after this session, it's like, oh, Nyoxin even give you a thumbs up and a clap. Yeah, so really with this, we know more about our body, especially our liver, and not only we know that what is this fatty liver disease are, also we know about what we can do with it. Is fortunately our liver are so kind with us, it's reversible. We can do something to reverse it. We are so happy with it. And so also for the informations for everybody, this recording will, and also an ebook from this talk will be made available at NNCC website later on. In 1 to 2 weeks time. The website address is myNNCC.org. At the same time, you can like and follow our Facebook for all the upcoming all the upcoming talks and sessions. So just also for your information, we are going to have 2 more sessions with Prof. Chan and also Dr. Chua, which talking about hepatitis B and also colorectal cancer. So it's really interesting one, and we hope to see everybody again soon. So with that, I'll thank both Prof. Chan and also Dr. Chua again. Thank you for spending your time with us today, and goodbye. Let's see you again in next time. Thank you.
Thank you. Bye-bye.
Yes, thank you.
Thank you.